back to my channel. If you are new, you know what I always say, go ahead and hit the, you don't know what I always say because you're new, but go ahead and hit the like, comment, and subscribe button. If you are returning, welcome back. Thank you so much for watching my video. I really appreciate the support and all the love. And yeah, so we're just gonna hop into this video. So I wanted to create a video of what you can kind of expect as a new grad nurse practitioner and some tips to kind of help you along the way. I have been a nurse practitioner now for about 10 months. I passed my boards in December of 2019 and I started practicing, got my first job as a nurse practitioner in March of 2019. So, you know, it's a transition and a change that you have to kind of go through. When you're a nurse, you know, if something goes wrong with the patient, you just get on the phone and you call the doctor. But when you're a nurse practitioner, the nurses are calling you. The ball's in your court. You're the person making the medical decisions, and sometimes that can be a little bit stressful, but you just have to sit with yourself and realize you've had all of this education, you got your degree or degrees, and you're capable of making medical decisions. So things I recommend when you are seeing a patient for the first time, I'm going to recommend that you do a thorough, you know, head-to-toe assessment. Of course, make sure you ask them a review of systems initially, because this is a new patient, you don't know their medical history. Get a good past medical history, get a good surgical history, get a good social history, and get a good family history. Basic labs that I typically order a CBC, I typically order a BMP, I order a lipid panel, I always order a urine just in case, and those are the basic labs that I order. Make sure you ask them about vaccinations if those are applicable. I'm going to also recommend that you find a person, whether it be a nurse practitioner, it could be a physician, it could be a PA, anyone that has experience as being a primary care provider, and you know, they can guide you and help with your medical decision making. That is also very important. You always need somebody that you can call and reach out to when you're stuck in a situation or you're not really sure what to do for a patient, because you don't want to make a medical decision and you don't really have the information that you need to do so, because again, you are the provider, you are, you know, over this patient's care, and you want to make sure you're doing the right thing and you want to make sure that you're providing the best care possible. So let's talk about some helpful apps that you guys can download to use to help you with medical decision making for patients. I'm actually going to scroll through my phone right now, so you know that I use these apps, and let's see what apps I have to use. I use UptoDate, which basically you can put a diagnosis in there and it tells you current guideline recommendations as far as treatment, as far as diagnosing whatever the disease process is. UptoDate is my go-to app. That is the app that we actually were instructed to use in my nurse practitioner program. So I have UptoDate. Thankfully, the company that I work for paid for my subscription, so that is also something you probably want to look into also. Another app that I have is the EMRA Antibiotic Guide, which is very good. It literally tells you the antibiotics for any type of infectious processes your patients might have, whether it be, I'm just going through here, it could be the bone in the joint, cardiovascular, CNS, GI, GU, all of the body systems. You just click what body system your primary source of infection, and it'll give you the antibiotics that are recommended. I have the US Prevention Task Force app. This app is for preventative health recommendations. You basically put your patient's age, whether they're male or female, a tobacco user or sexually active or currently pregnant, and it just has these little guides on here, and basically it gives you recommendations based on all of this information that you enter as far as preventative screening, whether it be a mammogram, a pap smear. So that's very important, especially when you have patients who may never have had a mammogram, may never have had a colonoscopy. Then you can recommend these preventative health type services. So that is a really good app to have on your phone. Only 3 apps that I use, guys. Like I said, UptoDate, that you should have UptoDate. That is the best app that I can recommend for you guys. So something else that was new to me as a nurse practitioner was making referrals. So making referrals to cardiologists, to nephrologists, making referrals to home health, which I do a lot of. I do a lot of home health referrals. I also even do hospice referrals. So getting used to knowing when you need to refer a patient to those services, especially home health, because there are a lot of patients who may need blood pressure monitoring weekly in the home and just aren't financially able to afford a blood pressure cuff or monitor. In that case, you would want to refer that patient to home health, especially if they have uncontrolled hypertension. Patients who have falls, you need to probably refer that patient to physical therapy. If the patient's having issues affording their medications, if they need services for meals, things like that, a social worker would be the best person that's in that referral to help that patient. So just getting used to making referrals in general is something that comes with being a nurse practitioner. So that is my tip for that. So now we're going to talk about the charting, which can be very tedious. It can be time consuming. I know when I first started charting as a nurse practitioner, I would stay up sometimes to 2 a.m. closing my chart. You want to make sure your charts are closed, because a lot of times if you're working for a company that, or an office that bonuses based on your chart close rate, you want to make sure your charts are closed because you want to make sure that you're going to get your bonus. Yes, it does take time. I know there's a lot of apps that people use to dictate, so it makes their charting go a lot faster. I actually pre-prep my charts, especially if it's a patient I've seen before. I pick the diagnoses that I know I'm going to address during that visit, and I do my charting as much as I can when I'm physically in that encounter. Close as many charts as you can, because you don't know when you'll have time to close them, and then like I said, that can affect the length of time you're having your charts open, and also your bonus if your company offers a bonus. So now we're going to talk about prescribing medications, because as a nurse practitioner, that is something that you will have to do. So my tips for when you're prescribing meds: make sure that you know exactly why you're putting the patient on that medication. If it is a new medicine, make sure you have the correct dose. Another app that you can use is Epocrates. It is an app that basically will tell you, for whatever medicine you're trying to prescribe, the recommended dosage, the frequency, and the duration. It also will put the medicine with certain diagnoses, which is very helpful. So make sure you get that app too, because that's a really good app. But yes, so make sure you know the dose, why you're putting the patient on that medication, how long you want the patient to take the medicine, the number of tablets or capsules you want the patient to have, and make sure you put the amount of refills that the patient can have if refills are needed. Pharmacies will call you if there is any clarification needed when you are prescribing meds, but I always try to make sure that I'm thorough, and I'm putting everything I need to put when I'm prescribing that medicine, and I go through those things that I just said, those steps, to help me before I send it. Because you don't want to prescribe something that's not the correct dose, or you don't want to prescribe an antibiotic that the patient is allergic to. Always check your allergies before you prescribe any medications. And always, if you are prescribing an antibiotic, go ahead and mention to the patient, even if they don't have any allergies, just mention the side effects. You should do that with all medicines, but especially antibiotics, and let them know if they have any of those side effects that they need to notify you so that the medicine can be changed or discontinued. Also, if you are in a state where you can prescribe, make sure you know what scheduled drugs you are allowed to prescribe, and if you are allowed to prescribe narcotics, how many days of that medicine you can give to the patient. That is going to be very important, because you as the provider need to know what you can do, which is why it's important for you to print your State Nurse Practice Act. Last and final tip is going to be to always make sure that you can limit the amount of work you're bringing home. For me, my home is my peace. I'll tell anybody that. I try my very best not to bring any work home. Sometimes you have to. I mean, that's understandable, but you shouldn't bring home work every night. You need time to recharge. Work in that case should stay at work. And even if you gotta sit in the parking lot and chart and close your charts, especially if you work in a home setting like I do, I will go to Starbucks and get me a coffee and sit in the car and chart and close my charts. It may be like 3 or 4 charts that I had left, just to prevent bringing it home and disturbing my peace. So that is gonna be my final tip. Make sure you're able to separate work from home, get some rest. Don't drive your mind crazy trying to figure out every little thing with each patient, because it is impossible and you will burn yourself out. So that is it for this video. I hope you guys find these tips helpful. If you are graduating, congratulations. If you are starting your new journey as a nurse practitioner, you just got your job offer, congratulations. It is exciting, it is rewarding, and it shows that your hard work really has paid off. And I know that each and every one of you watching this video will do great things. Just give yourself time to develop as in this career and to develop as a nurse practitioner. And if you guys need any more information, leave it in the comments below. Do not forget to like and subscribe to my channel. And thank you guys so much for watching this video. I'll see you in the next one.